So in today's video, I'm going to do something a little different and go over some medical mnemonics and start a series on just different tips and different things I have discovered to learn medications, to learn about diseases and disease processes. And these are things that can help you in nursing school and it certainly helped me in nursing school, but it really helped me so far in nurse practitioner school. Just little different mnemonics, going over medications and different things. So, in today's mnemonic that I want to share is morphine. And I want to actually specifically go over the side effects of morphine. And the mnemonic for that, of course, a mnemonic is where you spell it out Morphine, and the M stands for meiosis. So, one of the side effects with morphine, you'll get constriction of the pupils. And really, with any opiate, you'll get constriction of the pupils. The O stands for obtunded or sedated. Really, more so sedation than obtundation. Obtundation. Boy, that's a tough word. Obtunded or sedated. So you will see sedation with morphine. Respiratory depression. That is one of the main things you want to look for as a nurse when you're giving morphine. I've worked for years in hospice, so typically if you have a patient whose respirations are starting to go under 12 or 10 to 12, they start going under that, you may want to hold morphine because they're going into a respiratory depression. Pneumonia. It can specifically cause aspiration pneumonia. Patient gets drowsy, they're trying to eat, they're falling asleep while they're eating. That's one way. That's typically seen with morphine as a side effect. The H stands for hypotension. You will see low blood pressure a lot of times, especially with end-of-life care and hospice patients who are taking morphine. You'll see low blood pressure. You'll also have infrequent bowel or bladder. And what does that mean? Well, it causes, like many opiates, it causes constipation, but it also causes urinary retention. So if you have a patient who is on morphine and you notice they haven't gone to the bathroom in a really long time, and they're having pain from that, could be a cause from the morphine. So the N is nausea, and nausea is always, not always, but nausea can be followed by emesis or vomiting, barfing, yak, hurl, blowing chunks, or upchuck. The numerous things you can call vomiting, but emesis fits the morphine mnemonic. It seems like every medication that I'm learning or learning about has nausea and vomiting as a side effect. Anyway, so that is morphine and the morphine mnemonic. Tell me down below in the comments if you like this, you want to see more of these. I'll try to keep them quick and to the point. And then one other thing to say about it is if you go over to Mnemonic and you really want to learn these medications and learn more about them, and a lot of the same things I said, they have Mnemonic for morphine, and it talks about some of the same things, the constriction of the meiosis of the pupils, different ones that they talk about here. And it also has links to other websites like Osmosis or Lecturio to further go over morphine, because you can't get enough of going over something in order to learn it. Anyway, with that said, everybody have a great day, and like and subscribe.